The condition where pradhir and off-rages happen, the condition caused due to the involvement of many pathologies, the condition can be managed through diet modification as it is called by Mithya Ahara and Vihara. This condition is nothing but Raktapradara. Myself, Dr. Chaitra, third year PG Scholar, Department of Swasthavaratha, SDM College of Ayurveda, Hassan. Here before you present a case on Raktapradara that was managed through pathya kalpanas diet as well as lifestyle modification. A patient aged 37 years came to the OPD with a complaint of excessive menstrual bleeding hampering her regular activities with pain per abdomen, thighs, pelvic region during menstrual cycle since 7 years. The patient was apparently healthy before 7 years, later developed with mild pain during menstrual cycles associated with more bleeding along with fewer clots. This went on worsening so that it hampered her daily activities. She had consulted many hospitals for the same. Hormonal therapy was given for symptomatic relief. At last, hysterectomy was suggested. She was also a known case of hypothyroidism, endometriosis, as well as intramural uterine fibroid. Her past history says that she used to intake an excess of hormonal pills for postponing her periods 4 to 5 days at a dose of 2 TID every month, and her diet history says that she was overnourished. She had a history of taking ati, madhura, guru, katu ahara, irregular food as well as sleep patterns. Her menstrual cycle was 5-day cycle for every 30 days. Flow was heavy, but the nature of flow was heavy, thin, fewer clots associated with pain, and number of pads she used was 4 to 5 fully soaked. A general examination BMI was 30.48 kg per meter square, which shows that she was overnourished. Her per abdominal examination did not have any abnormalities per vaginal, no abnormalities per speculum. Mild erosion was seen in the cervix. Systemic examination, no abnormalities was seen. Assessment criteria was done with PBAC scale. For pads, it was the points was 80, and for pain, it was 8. This was from second to fourth day of her menstrual cycle. This was the lab investigation before treatment. And coming to Nidhana Panchaka, excess of hormonal pills as well as Mityahara and Vihara ended with the Lakshanas like Atiraja Pravati, Ati Vedana, Tanu, Raktasrava, and Angamartha. If she is doing yoga regularly, having a mind with less spicy food, it was lessen the condition. If she had outside food, irregular sleep habits, again worsened her condition. So the provisional diagnosis was Vataja as well as Pittaja Raktapradara and Udavartini Yoni Vyapat. But like looking at the Lakshanas of flow, it was considered as Vataja Raktapradara. The treatment plan was Apatapana line of treatment. Diet and lifestyle modification was done for Patyakalpana, Palandupeya as well as Eshtidati was given. Advice to the patient, diet chart was given every week along with yoga abhyasa. Palandupeya, that is Palandu fight with Yamaka Sneha, Gritha and Thaila added with 5 ml of Surasa, that is Tulasi Swarasa. Peya is made using Laja, given 200 ml twice daily. For Eshtidati, it was Dadi, it was Eshtimatu and Nagara taken in equal quantity, added with Shakara, Madhu mixed with Dhadi, and was given from 25th day of previous cycle to 5th day of the next cycle every month. Their chart was planned like this. Dhanika Mahima was given for doing Amapachana as well as for Pittaharana. A tablespoon of ghee was advised daily. Palandupeya was given twice daily. So vegetables like ashcard, snake card, upodika, rich card was given. Dry fruits, milk, buttermilk, mudka yusha, every nutrition was taken care so that the nutrition drop would not be there. Along with that, physical activities for walking as well as yoga abhyasa was suggested. This was the yoga abhyasa where practice time was given would be 1 hour. This was for improving both physical as well as mental health. Follow-up was done every week through call to change her diet pattern if required, and patient was asked to visit the OPD at the end of the 5th month of every cycle to assess the parameters. The criteria, PBAC scale reduced from 80 to 30 and pain reduced from 8 to 4 at the end of the 3rd month. The diet plan is made so that Apatarpana is happening without increasing Vata as well as reducing Pitta. Also does Amapachana. Though complete cure is not obtained, patients fight relief so as to avoid surgery, and these patyakalpanas are classical, which does Vata Pitta Hara as well as having hemostatic property. To conclude, Ahara is mentioned as Mahabheshaja, Palandupeya and Eshtidati. The patyakalpana shows a promising result, correcting the lifestyle, regular exercise, good sleep patterns, healthy and proper diet would improve mental health and help in preventing and protecting the women's health. Thank you.